So, who qualifies for a heart transplantation then, and who has to keep living with the ventricular assist device for the rest of their life? Like, how do you choose or select the patients for heart transplantation?
So now you're talking about a key piece. You know what the thing about heart transplantation is that it still remains the gold standard for advanced heart failure care. The average lifespan in the contemporary era with a heart transplant should be above 90% in 1 year, meaning most of your patients should be alive after. So that is a CMS mandated percentage that we want to have. And contemporary, generally, average lifespan for a heart transplant in America is about 12 to 13 years. So you can get up to 20 years as well, but it all depends on how your clinical course goes after transplant. The assessment for a heart transplant is multifactorial. It's done through a specialized group and committee, as with any organ transplantation. You have to have a diagnosis of stage D heart failure, that everything has failed. Then you have to go through assessment that the heart's truly at the end. We can do that by one or two ways. We do both most of the time. Cardiopulmonary stress testing is an exercise test in which we put a mask on your face and check your oxygen and carbon dioxide exchange. The heart, in its primary function, is to deliver oxygen to the tissues. There is loss of myocardial reserve. You will see that because your heart will not be able to maintain a high level of oxygen and low levels of carbon dioxide in exercise, and that curve will cross really rapidly, which is called the anaerobic threshold. And then you start seeing buildup of lactic acid in the heart and in the body, and then causes a loss of stamina and loss of reserve. So if that, in these advanced patients, that happens really early, and you have also your exercise VO2 max, which is your oxygen consumption, drops significantly based on your body weight. So your ability to perform is confirmed to be really, that's number one. We look at certain numbers. I'm not going to talk about the details on the cardiopulmonary stress testing, but that's confirming that you truly have advanced. Then we do what is called the right heart catheterization, which is mandatory to list someone. And that's, you numb the skin here, or you go to the wrist or the arm catheter that has a sensor in front of it that can then measure pressures. And we park it in the proximal pulmonary artery. And then using that, we measure the flow of the pump. Every pump generates a flow. The heart should be generating a certain flow, and that should be enough to supply your body habitus. So that's called cardiac index. We index it to your body size, your body surface area,